So the brachioradialis is this long fusiform muscle, and it is one of the two muscles of lateral compartment of forearm. The second muscle of this compartment is the extensor carpi radialis longus muscle. This muscle forms the lateral boundary of this triangular anatomical area called the cubital fossa. So the brachioradialis muscle has got its origin from the superior two-thirds of lateral supracondylar ridge of humerus. And then in the middle of forearm, this muscle forms this flat tendon, which inserts onto the lateral aspect of distal part of radius, just superior to the styloid process. So if we discuss the actions performed by the brachioradialis muscle, so when the forearm is in mid-prone position, the brachioradialis muscle flexes the forearm at the elbow joint. In terms of its innervation, the brachioradialis muscle receives its nerve supply from the radial nerve. The radial nerve runs deep to the brachioradialis muscle when it enters the forearm, and here it gives off branches to this muscle. So if we just look at the origin of the radial nerve, so this nerve has got its origin from the posterior cord of the brachial plexus. And this nerve has got its nerve fibers from the anterior rami of 5th and 6th cervical spinal nerve roots. Lastly, we will study the arterial supply for the brachioradialis muscle. So two arteries supply this muscle, and these are the radial recurrent artery and the radial collateral artery. The radial recurrent artery arises from the radial artery, and the radial artery arises as a lateral division of the brachial artery, while the radial collateral artery arises from the profunda brachiae artery. And the profunda brachiae artery is a branch of the brachial artery. These two arteries, that is the radial recurrent and the radial collateral arteries, form anastomosis around the elbow joint, as you can see. So this was a tutorial on the brachioradialis muscle. So the extensor carpi radialis longus is this long fusiform muscle, and this muscle can be found in the lateral compartment of forearm. It is partly overlapped by its fellow muscle in this compartment, the brachioradialis muscle. So this muscle has got its origin from the inferior third of lateral supracondylar ridge of humerus bone. And after origin, its muscle belly gives rise to a flat tendon in the middle of forearm, which travels inferiorly along the lateral aspect of forearm towards the hand. And within the hand, this muscle tendon inserts onto the dorsal aspect of base of second metacarpal bone. So now, in order to study the actions performed by this muscle, we need to concentrate on the name of this muscle, the extensor carpi. That is, this muscle is an extensor of the carpus. So simply we get to know that this muscle extends and hyperextends the hand at wrist joint. And as this muscle inserts onto the radial aspect of hand, so the second action that this muscle performs is that this muscle abducts the hand at the wrist joint. Now in terms of its innervation, the extensor carpi radialis longus muscle has got its nerve supply from the radial nerve. So the radial nerve arises from the posterior cord of the brachial plexus, and the nerve fibers involved in supplying the extensor carpi radialis longus muscle are the anterior rami of 6th and 7th cervical spinal nerve roots. And lastly, we will study the arterial supply for this muscle. So this muscle has got its arterial supply from two arteries, And these are the radial recurrent artery and the radial collateral artery. So the radial recurrent artery is a branch of the radial artery, and the radial artery arises as a lateral division of the brachial artery. While the radial collateral artery, as you can see, is a branch of the profunda brachii artery. And then the profunda brachii artery arises from the brachial artery. These two arteries, that is the radial recurrent and radial collateral arteries, form anastomosis around the elbow joint, as you can see. So this was a tutorial on the extensor carpi radialis longus muscle. So the extensor carpi radialis brevis is this long fusiform muscle, and it is one of the muscles of the superficial part of the posterior compartment of forearm. So this muscle has got its origin through the common extensor tendon from the lateral epicondyle of the humerus. And after origin, this muscle runs inferiorly along the posterolateral aspect of forearm and forms this flat tendon in the middle of forearm. And this tendon then runs deep to the extensor retinaculum of wrist to insert onto the posterior aspect of base of third metacarpal bone. Compared to its fellow muscle, the extensor carpi radialis longus, which inserts onto the base of second metacarpal bone, as you can see. So now if we discuss the actions performed by the extensor carpi radialis brevis muscle, so as the name of this muscle, the extensor carpi, suggests that this muscle is an extensor of the carpus. So this muscle extends the hand at the wrist joint. Since this muscle runs along the radial aspect of forearm and inserts onto the radial aspect of hand, so this muscle also abducts the hand at the radiocarpal and midcarpal joints. In terms of its innervation, this muscle receives its nerve supply from the radial nerve. The radial nerve supplies this muscle through this branch called the deep branch of radial nerve. So the radial nerve arises from the posterior cord of the brachial plexus. And the nerve fibers involved in supplying the extensor carpi radialis brevis muscle are the anterior rami of 7th and 8th cervical spinal nerves. So now if we study the arterial supply for this muscle, so this muscle has got its arterial supply from the radial recurrent artery. The radial recurrent artery is a branch of the radial artery, while the radial artery itself arises as a lateral division of the brachial artery. So that's a tutorial on the extensor carpi radialis brevis muscle. So the supinator is this flat fusiform type of skeletal muscle that lies in the posterior or extensor compartment of forearm, and it occupies the deep layer of muscles in the posterior or extensor compartment of forearm. So this muscle has got a broad spectrum of origin, and it originates from the lateral epicondyle of humerus, the annular ligament of the proximal radio-ulnar joint, and the supinator crest of ulna. And after origin, the fibers of this muscle travel inferolaterally over the elbow joint and spiral over the proximal 1/3 of radius to insert onto the posterior, lateral, and anterior aspects of neck and shaft of radius bone, as you can see. So let's proceed towards the actions performed by this muscle. So the name of this muscle clarifies that this muscle is a supinator, and this muscle supinates the forearm at the proximal radio-ulnar joint. Now lastly, let's talk about the nerve supply of this muscle. So just like the other extensor muscles of forearm, the supinator muscle has got its nerve supply from the deep branch of radial nerve. So if we take a lateral view of forearm, then you can see that this nerve is the radial nerve, which gives off this branch called the deep branch of radial nerve, also called the posterior interosseous nerve of forearm, while this nerve is the muscular branch to the supinator muscle, while the radial nerve itself arises from the posterior cord of the brachial plexus. And the nerve roots involved in supplying the supinator muscle are the anterior rami of fifth and sixth cervical spinal nerves. So that's all about the anatomy of supinator muscle.